I was just almost gone. They really didn't think that I would make it through it. And when they finally got me back to where there was something of me, they put me in on the second floor at St. Joe's West, and I had the most blessed of all people to take care of me.
What I thought was really unique was several people told me how they were working on me, even in intensive care.
Did they save your life?
Yes, ma'am, for sure.
Wow.
I had one little gentleman, Adam, I can remember his name, sweetheart. He would brighten my day. One of the nurses, I am not good with names at remembering, but this little nurse, I remember very, very, very plain. Her name's Mandy. She would hug me and hold me, tell me things were going to be all right. She'd comb my hair for me.
They were prompt with coming around to the time things were supposed to be done. They treated me great the first time and the second time. Everybody.
When I felt that I was going to give up and I'd get blue and sad, she was there to help me through some of that sadness and that hard time.
They make you feel like it's a personal one-on-one relation, just, you know, platonic. But, you know, just to care when they come in and treat you.
You feel like they actually really care?
Yes, ma'am, for sure.
I have been in the same hospital a few years back and was not happy with a lot of what went on.
But this time you noticed it was different.
Oh my goodness. Oh, it was night and day difference.
I think it is changing the relationship between the nurses and patients because there's just something about the atmosphere that's changed since we started relationship-based care, and people just take more time. They're kinder. They get to know people. It's good. It's our whole perception of how patient care should be done has changed.
They feel like you're not only like health-wise taking care of them, you're taking care of them almost as if they're like your family. They're not just some random person to you.
I didn't have to ask for clean sheets or blankets or, you know, they would just automatically just be right there. You know, if they saw that I was overheated, they would bring me a fan or turn it on.
It's just based on their needs. So it's helpful to the nurse to know those needs, and if you spend the time talking to the patient, then you get to know what they are, and that helps with care.
They loved me back. I know they loved me back. And they sent me a nice card saying that I was one of their nicest patients ever. And that thrilled me to no end. I bragged so much about it because it made me feel their warmth and their love.
Thank you.
So for each visit they sent you a card?
Yes, ma'am.
Oh, how neat.
So, see, that's quite a few
And they all
nurses.
signed?
Yes, for sure.
What did you think about that when you get that in the mail?
Well, it was awesome too, just that they were, you know, considered to do that.
We send all our patients a card when they go home, and all the nurses and nurse aides that take care of them sign the card. And it's just a you know, I hope you're doing well card after the hospital. And so I think she had taken all the names and she'd written them all over this huge valentine and brought it up to the desk area. And she said, I've got a gift for you guys, you know. And everybody knew her and came up, oh, Tara Lee, how you doing, you know. And
I wish I was here when she came up here because I remember her. And when I saw that, I was like, oh, I should have stayed because I went home early that day too.
Oh.
And it would have been awesome to see her because she wasn't in a bed or a gown. And I'm sure that was. I mean, I'm sure she's a different person now.
It was great seeing her well and seeing her back. You know, it's good to see them when they're not lying in a bed wearing a patient gown. They're real people. You know, it's nice.
So tell me about Valentine's Day and what is it that made you want to send these folks some flowers?
So, you know, just showing my love back for the love they showed me.
They gave me my life back. They made me want to live. They gave me the hope that I needed and the help that I needed.
That's our job, is to get them up and going and back to their normal life and well and happy, what she was when she came back. So I think we did a good job.
It's gratifying to know that you do more than just make money here. You make a difference.